There is much misinformation surrounding traumatic brain injury. In discussing brain injury with the public and with professionals, I frequently need to correct misinformation and myths that make the understanding of the TBI more difficult. Today, I would like to discuss and dispel some of these myths. For each one, I am including a link in the text accompanying this video for authoritative discussion of these important concepts. Myth number 1. A concussion is not a brain injury. Not true. It has long been recognized by the Centers for Disease Control, the American Academy of Neurology, and other prestigious medical groups that a concussion is a brain injury that can have lifetime consequences. A concussion can result from a bump, a jolt, or a blow to the head. And the signs and symptoms of a concussion are varied, including physical, cognitive, emotional, and behavioral disturbances. The Centers for Disease Control's website can provide detailed information. Myth number 2. A CT scan or an MRI scan can see a brain injury. Not true. Although a CAT scan and an MRI scan are useful to determine brain bleeds, skull fractures, and pressure within the skull and brain cavities, these scans are not sensitive enough to detect the microscopic damage to nerve fibers within the brain, which results in tears, strains, and bruising of nerve cells, as well as chemical reactions that often take place following brain trauma. It's not unusual for the CT scan or MRI study to be normal in a patient with a TBI. The fact that the CAT scan or MRI is negative does not rule out a traumatic brain injury. Absence of proof is not proof of absence. This is a saying used by medical professionals when they discuss the limitations of these tests to rule out a brain injury. The American Society of Neuroradiology has important information on this topic. Myth number 3. To be diagnosed with a concussion, there must be a loss of consciousness. False. There is no need to lose consciousness to sustain a brain injury. A concussion can take place even without losing consciousness, and most concussions do not involve a loss of consciousness. The definition of a concussion includes being dazed or confused in the period immediately following the traumatic event. Some individuals may not remember all events immediately before or after the trauma. More information can be found again at the American Association of Neurological Surgeons website. Myth number 4. You need to hit your head in order to sustain a brain injury. Not true. You do not need to hit your head or have an object strike your head to sustain a brain injury. You shake it, you break it. Is often said to describe the movement of the brain within the skull, which can cause shearing, tearing, or stretching of these nerve fibers. The inside of the skull contains many protrusions and sharp ridges, which could cause damage to the soft and delicate brain fibers when the brain is thrust up and against the interior of the skull. Brain injury can also result from the rotational movement of the brain within the skull. More information can be found at the American Association of Neurological Surgeons website. Myth number 5. Everyone has a good recovery following a brain injury. Not true. Brain injury of all types and severities can have lifetime and even permanent consequences. Not everyone achieves a full recovery following a traumatic brain injury. And the most recent and comprehensive studies have found symptoms of brain injury persist for over a year following the original injury. Here's an article from the Journal of Neurotrauma. Other comprehensive studies found an increased risk of developing chronic cardiovascular, endocrine, neurological, and psychiatric disorders following brain trauma of any severity. An article on this important topic can be found in the Journal of the American Medical Association. I will return in future episodes of the Brain Injury Insider to discuss and dispel other frequent myths about brain injury. Until next week, remember, the best cure for a brain injury is prevention. I look forward to meeting with you next week on a new edition of the Brain Injury Insider.